Thanks, Alyssa. Now we're bracing for a tough week ahead and taking a closer look at the COVID-19 situation in our area. Joining us once again this morning from Gunderson Health System, infection preventionist Megan Meller. How are you doing today?
I'm doing great. How are you?
Doing well. So we want to start off with masks. The CDC now recommending we should wear them out in public, correct?
Yep, correct. So that was the most latest recommendation. I think the best practice is still for people to social distance. But I think if you're at higher risk for developing severe symptoms to COVID-19, so underlying health conditions, immunocompromised, it probably doesn't hurt to wear a mask when you're out grocery shopping or running errands.
Okay, and this morning we're hearing about a case of a tiger at a Bronx zoo contracting the virus. Now, people are probably wondering, should we be concerned about our pets and what steps can we take to protect them?
I think for the time being, because this is the first case that we've known about this happening, I think our pets are safe. I caution that, with anything, we need to learn more. We need to learn why and how this happened. It also was the only large animal to get it. Some of the other types of big cats at the zoo were not affected. And so, for now, I just would practice caution until we actually learn more about why and how this virus transmitted to the cats.
Locally here in La Crosse, we have 22 cases. So what do we know about what we're doing with the idea of flattening the curve?
I'm really heartened by how well Wisconsin has been working to flatten the curve and for social distancing. We have a lot of cases in the state, in the county, but we're not seeing a dramatic rise every single day, and that in itself is really great news. And so I think if we can keep it up, then we're not going to see the big spike that we're seeing in other states. So keep up the great work, La Crosse.
Keep up the great work, right? But how important is it for our young, healthy people to continue social distancing?
Now more than ever, it's never been more important. Yep, we're flattening the curve, but we need to keep that curve flat. And the only way to do that is to continue to social distance, work from home. That doesn't mean you can't go outside. We're hearing some conflicting things about being outside, but definitely, go for that run, even if it's with a friend. Go on that bike ride, do anything, outside, fresh air is really good. But again, this is not the time for backyard parties or, for getting together with, hanging out with your best friend. It's just practice social distancing and, at least for the next, 2 to 3 weeks, and hopefully we'll be in the clear.
Now, with our local healthcare system, what do we know about the personal protective equipment? Do we have enough?
For the time being, we do have enough, but I think with any healthcare system, we're looking at projections for a few weeks out. If we have a surge event, we're going to be short on personal protective equipment, and so this is where flattening the curve really helps. So we can start getting supplies in and hope have enough for if that were to happen. Also, we're taking donations, and so it's never if someone wants to help out in any way, reach out to the medical foundation here, and they will tell you what we're taking. So we have enough for now, but we are looking at ways to prolong what we have. So we're looking at reusing face masks, wearing face masks for longer periods of time, face shields, cleaning in between use, but. Usually we're a one-time use, with any healthcare system, but we are looking at ways to kind of prolong what we have to make it last.
And just really quickly, do we have enough testing equipment?
So we do have enough. We've been able to expand the number of people that we are testing or the different populations. And so I think we're doing a really good job of testing and figuring out who has it and who doesn't. We're still a little bit short. We'd like to test, everybody. But for the time being, if you have, the fever, shortness of breath, those lower respiratory symptoms, it's definitely worth calling the nurse advisor or calling your primary care provider to inquire about testing.
Well, Megan, that's great to hear. Definitely some good news coming out of our area as we work to flatten that curve. Thank you for joining us this morning, Megan.
Thanks again for having me.
All right, now with a look at what's ahead on Good Morning America, here's Ginger Z.
Coming up here on GMA, we are tracking all the latest on the coronavirus developments, and that includes our hospitals just days away from reaching capacity. This morning, we are taking you inside one of those hospitals here in New York to see what it is really like. Doctors and nurses push to their limit while other cities and states around the country are bracing for a surge in cases. That is all coming up right here on GMA.